Hello, everyone. I'm Dr. Niro Sivathasan here in Sydney, and I'm delighted to have Dr. Aniello Iannuzzi here also in New South Wales, and Dr. Chris Davis joining us from Queensland. We are very lucky to be able to share the news of our forthcoming conference with you. It's called the Misdeeds of ARPRA. It will be covering the medico-legal and medico-regulatory domains that affect the lives of every Australian. This is a very important conference because it will be looking at the mechanics as well as the processes and the history of Australia's healthcare regulators, primarily ARPRA. A lot of healthcare practitioners, not just medical, but also paramedical, such as nurses and dentists, have got a story to tell about their experience with ARPRA. Now, we all know, of course, that every healthcare system requires a regulatory body. However, our concern, which is very widely shared, is that the processes employed by ARPRA are perhaps less than ideal. Now, to help explore this, we've got a superb lineup of speakers, all very senior doctors covering the whole range of medical specialties, from general practice to surgery to gynecology and beyond, as well as a number of very eminent lawyers with experience both in the medico-regulatory fields, but also to do with ARPRA and the general legal processes. So I'm going to pass the mic over to Dr. Iannuzzi, who's going to talk a little bit about why the Australian Doctors Federation has come together with AMPS, which is the Australian Medical Professional Society, to convene this very important conference.
Thanks very much. The Australian Doctors Federation is very proud to participate and to co-host this with you. We have been around for about 30 years as an organisation, and from the very outset of APRA back in 2010, we have had strong concerns, and in fact, I think we remain the only organisation that has remained opposed to the concept of APRA since its inception. Now, APRA was sold to us as a way of simplifying registration, that we could go across state borders and we'd only need to be paying one registration to let us work all over Australia. And whilst that may be so, the reality is that the fees for registration have blown out. They're well over $1,000 in most jurisdictions now. And APRA has a lot of other features that are not necessarily well explained and not necessarily in the interests of our profession or indeed all the professions that come under its umbrella. So this is a very important conference. It's bringing together some very eminent professionals from all sorts of professions, and I think anyone who's interested in policy, especially in health policy, should attend.
Absolutely, and I'd very much like to echo your words and to also reinforce them by saying that the experience that a lot of us have got is that there's very little accountability with ARPRA. Transparency is perhaps something that leaves a lot to be desired, and these are areas that a number of the lawyers are going to be exploring. And we're delighted Mr. David Gardner, who will be joining us. David was an ARPRA manager and investigator, and he's a lawyer. He then was a whistleblower about many of his concerns to do with ARPRA, and since then he moved into supporting and defending doctors in the pursuit of truth. And that is ultimately why we are all here. We want to improve the standards, not just for healthcare professionals like us, not just for the doctors, the nurses, the dentists, and indeed the 16 healthcare groups that ARPRA oversees, but of course we want to improve the care that we afford to our patients all around Australia. And I think it's important to note that some of the processes employed by ARPRA have resulted in many healthcare professionals committing suicide or leaving their respective professions due to the stresses and the disappointments. And of course, it's the Australian public that suffers when there are fewer providers, particularly the experienced ones, many of whom have also decided to retire due to a number of baseless changes and regulatory requirements which are not evidence-based, which have been mandated by ARPRA. And of course, that has resulted in longer waiting times and compromised patient care. Chris, speaking of patient care, you have extensive experience with the systems in Queensland, and perhaps you can share some of your thoughts with us.
Yeah, thank you very much. This meeting is vitally important. I have been involved over the years, as have others, making submissions to the Australian Senate about ARPRA, and really there's no enthusiasm for changing the system. The system works very well for politicians. It's basically a quango, which stands for a quasi-autonomous non-government organisation that gets its power from government but actually is autonomous. And they have enormous power through the so-called national law. And as we've already touched on, it's really unaccountable power. And they really have enormous power that often gets overturned by the courts, but often only when enormous damage has been done to practitioners and enormous costs have been incurred that are passed on to doctors, and then they have to be passed on to patients. And in Britain now, they are getting rid of quangos. They just got rid of NHS England, for example, as being a superfluous layer. And quite correctly, because with the medical profession, we have some of our nation's brightest young students. They get into medical school, they spend years in undergraduate study, they then spend even more years in postgraduate study, they then graduate, but no sooner have they graduated than they subjugated. They're subjugated by the political system and by the corporation system. So years ago when I started as a young doctor, really there was only one thing in mind, and that was the patient. And so whether it was from the Hippocratic Oath or the later Geneva Declaration, our only focus, our only duty of care, our model of service was patient-focused, and that didn't matter whether you were in hospital, in the community, and doctors adjusted their fees according to the ability to pay. And then, of course, we've seen now politicians. We've seen enormous transformation of our profession. It is now represented by a green card. We're in election mode at the moment, and healthcare is now all about a green card, a bulk billed commodity. It's not about the patient anymore. It's about what the politician can get out of the medical system. And then it's made even worse because the corporations have been involved. And corporations, and it's just their obligation, they're there to maximize their wealth. And so they're there to maximize their wealth. The politicians are there to maximize the power. And the patient is lucky if they get a look in sideways. And ARPRA comes in as a way of subjugating the medical profession. So they've removed our power, our ability to self-regulate. Now, it's not just my opinion. I've already mentioned the Geneva Declaration, but there's also, of course, the World Medical Association. And the World Medical Association is very clear that doctors need to actually have an autonomous process where they can actually regulate their profession. That is the only way that the focus can stay on the patient. And we've been denied all of that. And as Aniello touched on earlier, it was almost like a Trojan horse. And it's the same thing with ARPRA. We were told that we were going to get a national registration system, but in the process, they removed our self-regulation like we used to have, and we need to get back. So this conference is absolutely vital, not simply as a talk fest. We've had too many talk fests. This conference has to be an opportunity for the profession to unite, for the profession to focus, and for the profession to actually act, to actually get self-regulation back. Mintzberg, who's an organizational theorist, talks about machine bureaucracies, which are big and clunky and rules-based and really are very bad at complex tasks. And as we all know, the practice of medicine is one of the most complex tasks that we human beings attempt. And we've got this bureaucracy that sits there with its rigid machine things that might have been fine for producing the Model T Ford, but it's totally inappropriate for the complexities and the nuances of medical practice. So we need to go back to a professional model, the so-called professional bureaucracy, and that is the small, nimble, state-based groups, not only for the regulation, but also to support doctors, because it's vital when you see a colleague who's losing their way. The worst thing you can do is hit them hard with a big stick. The best thing you can do is to relate to them, put supports in place, get them back on their feet instead of knocking them down. And ARPRA only knows how to knock people down, sadly. It's not their fault, it's just structure. So ARPRA is a part of a control and command system using coercive control, and it is very bad for patients because it's very bad for doctors. So this is an absolutely critical opportunity that we absolutely have to make the best of. This opportunity to actually review ARPRA, but not just review it again, decide what we're going to do as a profession.
You've touched upon so many important points. I'm trying to keep them all in my mind. Everything from, for example, centralization over bureaucratic systems and processes, such as NHS England. You've also mentioned the importance of the practice of medicine. Medicine, of course, is an artistic endeavor which is based upon an imprecise science, and it's not something that can be codified or made into an algorithm. ARPRA very much, again, doesn't have people with the appropriate levels of competence and knowledge in its ranks, and they tried to make guidelines and ideas into requirements, which inevitably results in a lack of individualized care for the patient, and then too much extraneous noise and interference and influence. And ultimately, the patient loses and the provider, the physician, also loses. You've mentioned also about, well, so many things to do with the World Medical Association and so on. And I think it's fair to say that many of us know that we are not doing what ideally we should be doing because we are being compromised by this overbearing regulator that seems to stand over everything. And the number of doctors whom I know from my medical legal work that are very much scared to deviate just in case ARPRA takes exception, it's heartbreaking. And I think these are some of the key things that we're going to be exploring. I think we're all absolutely delighted that we have a world-class group of speakers that are going to be on stage. We're going to be having panel discussions. A number of politicians are behind us as well, members of parliament, senators, and so on. Unfortunately, the date that was chosen, that being the first Saturday in May, 3 May, turned out to be the date that our current Prime Minister has chosen to have the federal election. So two of the speakers who are politicians are no longer able to attend. However, they are all producing videos of support. And I think that is the key thing here. The tremendous range of support we have, I think, means that we're hopefully going to affect some change, and we really need the engagement and support of not just our profession, the medical profession, but healthcare providers and, of course, the public. And perhaps, Aniello, you can
Yes.
close our...
Well, I think we've given you a good taste of what to expect on Saturday the 3rd of May. We encourage you all to attend. It's an all-day event starting at 9 o'clock. Please register and buy your ticket now because tickets are almost sold out. And we hope to see you to discuss APRA and to discuss how we defend and protect our professions for the future of Australians in their healthcare and in their medical care. Hope to see you soon. And on behalf of AMS and the Australian Doctors Federation, thank you very much.
Thank you all.